Hello Sihat, apa khabar? Hai, saya Sasha Saidin dan selamat datang ke Hello Sihat, apa khabar? Di mana kami ingin berbicara bersama anda dari hati ke hati.
Dan saya Dr Fariza, pakar perunding dan hos podcast Hello ini. Topik kita hari ini adalah penjagaan kesihatan wanita. Satu topik yang sangat topikal dan relevan kepada semua wanita, terutamanya pada saya dan Sasha.
Ya,
Ketika umur-umur begini,
betul ada.
sebenarnya kita amat berbesar hati Sasha, sebab hari ini kita ada seorang tamu yang sangat istimewa. Sangat berpengetahuan luas,
Daripada jauh ya.
berkaliber daripada jauh dan merupakan seorang pakar perubatan sakit puan yang akan membantu kita mengupas topik pada hari ini.
Okey, saya nak bagi background sikit tentang tetamu kita hari ini. Dr Ida Ismail-Pratt ialah seorang pakar perunding obstetrik dan ginekologi yang mahir dengan pengalaman bertahun-tahun di mana beliau berdedikasi untuk meningkatkan kesihatan wanita. Minatnya terhadap pencegahan kanser serviks dan memastikan kehamilan yang selamat mendorong pendekatannya yang berpusatkan pesakitnya di mana mereka diberi informasi yang tepat dan sentiasa dibimbing di sepanjang proses rawatan atau diagnosis. Now, Dr. Ida telah menamatkan pengajiannya di University Glasgow pada tahun 1997 dan seterusnya mencapai akreditasi pakarnya pada tahun 2010. MRCOG UK. You know this. I don't really know what that is, but sekejap lagi Dr. Ida akan explain further. Oh, wow.
Jadi pakar, dia ada exam banyak.
So
Lepas dapat MBBS tu first exam tu baru je doktor biasa. Maksudnya buat training, exam, sama belajar, viva, thesis. Then dapat kepakaran doktor pakar. So you jadi member of Royal College of macam this one obstetric and gynecologist lah. Lepas tu jadi pakar-pakar lagi. Fellowship pula.
So kat sini ada tulis lagi, ada lagi. Pada tahun 2023, beliau telah diberi penghormatan dengan fellowship berprestige Royal College of
Obstetrician.
dan Gynecologist.
Sudah dapat FRC.
Ini FRCOG.
Tu consultant, top
UK.
consultant.
Oh,
Wow.
wow.
Tadi M tu specialist, ni consultant.
Oh, wow.
Calang ya orang yang
Jadi beliau mendapat pengiktirafan atas sumbangannya kepada obstetrik dan gynekologi. Latihan dan dedikasi Dr. Ida yang meluas terhadap kesihatan wanita menjadikannya pilihan yang boleh dipercayai untuk penjagaan profesional di pusat klinik wanita beliau sendiri yang bernama Athena Women Specialist yang berpusat di Singapura. Jadi pertama sekali, apa khabar Dr. Ida?
Khabar baik and congratulations on season 2.
Alhamdulillah, thank you.
Jadi we'll go straight into the questions, because this is quite a serious topic. So we have a lot that we want to uncover here juga. So let me start with Pertubuhan Kesihatan Dunia. Walaupun wanita di negara perindustrian telah menyempitkan jurang wanita dalam jangka hayat dan kini hidup lebih lama daripada lelaki dalam banyak bidang kesihatan, namun mereka mengalami penyakit yang lebih awal dan lebih teruk dengan hasil yang lebih buruk. Malah di negara-negara maju, kehamilan dan melahirkan anak dikaitkan dengan risiko yang besar dengan wanita. Kematian, unfortunately, ibu menyumbang lebih daripada 1/4, 1/4 juta kematian setahun, menyebabkan jurang yang besar antara negara-negara berkembang dan negara maju. So, apakah pendapat Dr. Ida tentang in general kesihatan wanita berbandingan kesihatan lelaki, especially mereka yang 40 and above?
Okay, so apa yang Sasha persoalkan adalah walaupun kita wanita hidup dengan lebih lama kan, kenapa kesihatan kita lebih buruk when compared to men lah. It's not really a kind of a fair comparison. Tapi because when we talk about mortality rates, when we compare mortality rates of men and women only, it doesn't really give us the right picture. Okay? Jadi kalau macam for example, sebab kita selalu kata, oh, women win the longevity race. But actually, that's not really a true statement, because we don't really see what actually happens when we live longer. Okay.
All right.
Yeah. So it's not a win.
Okay.
Basically,
Okay.
we don't really know what's going on. People don't really know what's going on. So biasanya kalau for example, kalau lelaki 40 tahun ke atas kan, the dominant burden for them, okay, they die of mainly cardiovascular disease and certain cancers like prostate cancer, colorectal cancer, lung cancer. Okay, these are the ones that cause the main mortality for men lah. And so if we just compare mortality in men and mortality in women, yes, is in almost every population in the world, yes, men dies younger than women. But as I said, that's not really the issue. The issue is that because we women live longer, and remember, women in their 40s, okay, this is when we are leaders. We're starting to be leaders. We are contributing to society significantly. Kita juga, we have teenage children. We're looking after teenagers. And you know what teenagers are like.
Oh.
Yes.
And we also look after our parents. We are the pillar of the society because we look after everybody. Okay? So when we are doing all this, in women in their 40s and above, 3 other things are happening simultaneously that we have to juggle. Now, the first is the rise in women's cancer. Okay, so basically things like cervical cancer, we'll talk about it a bit more, womb cancer, ataupun cancer rahim, and also ovarian cancer. Now, for example, cervical cancer has no business killing women in 2026. Okay, we have the vaccine, we have a very, very good screening, but it still does. Okay, and we can talk about this a
What
little more
about
later.
breast cancer though?
Breast cancer is the same, but you know, so they're screening for breast cancer, but women still die from breast cancer. Okay, so that's the one thing that because we live longer, that's the first thing that we have to the challenges. Second is the hormonal changes that kita hadapi. Okay, the transition. It's a natural transition. Okay, it's a natural transition. But if we don't understand it, we don't know how to control it, or then it does affect our life in a significant manner. Okay, jadi kita kena faham. And then things like, you know, and this is what perimenopause, menopause, postmenopause. And when we have this, it's not just the symptoms that we're talking about, it's every aspect of our life that is affected. Okay? And remember, women, we live average up to about 80, 90 years old. We menopause maybe around kind of like about average 50 years old. We have 30 years of our life to live. Okay? And the third, and also with menopause, perimenopause, there are increasing chronic diseases also. Okay, osteoporosis, cardiovascular issues, type 2 diabetes. These are also the things that we face. And most men, you know, they face a bit lesser because we live longer. And the third,
I see what you mean.
Yeah.
I see what you mean. Okay.
Okay. So and I forgot what the third is now.
So you already covered the rise in women-related cancers.
Yes, the related cancers.
And then the rise in chronic diseases.
Yes.
And also the cancer to be aware of is the Khabar one lah. Which is the cervical, womb ataupun ovarian. And you were mentioning about the lack of protective effect of hormones.
Yes.
You need to talk about this.
So when we talk about mortality, women live longer than men, it's not, for me, that's not the focus. The focus is that kita sekarang ni di 2026, and also pregnancy and childbirth. Okay, women in their 40s can still get pregnant, but the risk of maternal mortality, morbidity is higher. Okay, especially in low and middle income countries. So these are the 3 things that we face when we are 40s and above. Okay, jadi the question is basically not about women living longer than men, but what we need to focus on is basically understanding that there is a gap in women's health. The gap of all these that I mentioned, there are evidence about management. There are solid signs
So
on how
nampak,
to yes.
you start nampak gap ni umur ada
Yes.
certain age tak yang dah start nampak gap ni?
Well, my meaning about gap is that when we talk about women in their 40s and above and all the challenges that we have, we do have solid signs in most of them to make sure there's safe pregnancy and delivery, that we can prevent cancer. We can also have a better quality of life. But the gap is what we can do to get all this, to overcome these challenges, and we actually do, can be quite big, especially in women in the middle income countries. Okay? So what we have to understand is that to recognize this gap, okay, what we can do and what we actually do, totally different thing. Okay? And what we as women have to recognize is that how can we make the gap, make the gap narrower, so that even though we live longer, it's not poorer health, it's not poorer outcome.
It's a burden.
Yes, and when we live longer, we also live a good life, a happy life, a healthy life, and also we can still play pickleball, we can still run for the bus when you're 102.
Do you think that also relates to mental health as well?
Yes, of course, that is one very important issue as well for women, because it's very seldom being addressed, especially for older women as well.
So, Dr. Ida, you mentioned very important point masa mula-mula tadi, apa isu-isu yang wanita hadapi, from 40 to our life expectancy 80-90 tahun. So, antara point yang saya suka you mention tadi, sebab kita wanita umur 40-50 ni, kita pasak society. Kita jaga anak, kita jaga elderly parents, kita contribute, we are leaders at our workplace and need to contribute to economy. Tetapi fitrah Tuhan menjadikan manusia, menjadikan wanita ketika umur 40-50 tahun ni ada satu perubahan secara fiziologi. Secara fiziologi maksudnya itu secara anatomi, secara biologi, itulah kejadian Allah ciptakan kepada kita. Iaitu perubahan dari segi mood. Dari segi, I don't really feel myself today. I can't sleep at night. Why do I have mood swings? Why do I get triggered? Padahal tak ada apa pun. And you're like macam overthinking tau. Because sometimes I go through it myself, at this age. So, adakah itu sesuatu yang saya overthinking, ataupun sebenarnya secara fiziologi memang ada sesuatu yang telah memberi kesan pada performance saya.
Hormones and all that.
Ya, ada satu perubahan. So, kadang-kadang kita, as friends, we cakap, I rasa nak menopause lah. I rasa nak perimenopause lah. And sometimes society, kita throw away these words casually. So, dengan adanya pakar di sini, so saya nak minta pandangan Dr. Ida. Bila wanita yang high function kan, kita macam nak perform kat tempat kerja, nak jaga anak semua ni. Tapi, dalam ni dah rasa, tak sedap. Period pun macam
Tak teratur.
Patutnya dah ni tapi belum. So what's actually going on, and is there a terminology that can precisely describe what we are going through right now?
Okay, so now before I describe the terminology, so the first thing that kita kena faham is like the main hormone in our body that is related to all this is estrogen, our female hormone. Okay, so estrogen ni is a steroid hormone, and it's mainly produced dalam kita punya ovary. So ovary kita, bila kita lahir, we have eggs. Okay, everybody has a finite amount of egg. We cannot make more eggs. We are born with the number of eggs that we have. Okay, so these eggs are the one that makes estrogen mainly. Okay, so bila kita ada menses, when we start having menses every month we have menses, we are losing about a few thousand of eggs. Wow, okay. So when we lose eggs, that means less eggs, less estrogen lah. So when we get to a certain age, 40s and above, bila there's not a lot of eggs left, therefore the level of estrogen slowly will declining. Tapi before they decline, they naik, they turun, they naik, they turun, they naik. It's all over the place. Okay. Now, not only that estrogen is important, tapi yang important juga adalah estrogen receptor. Jadi reseptor yang menerima estrogen ni dalam badan kita. Okay. Bila kita cakap pasal estrogen receptor, the only thing that usually people think about is kita punya menses atau our reproductive organ ataupun fertility. But our estrogen receptor ni actually it's in almost everywhere in our body. It is in our brain. It is in our heart. It is on our skin. It's not only the reproductive organ. It allows us to have good cholesterol. It allows us to have an even distribution of fat in the body. It makes our insulin works better. So it burns sugar better. Okay. So these are that's why when we talk about what we are talking about is perimenopause, menopause, and postmenopause. Okay. So when we talk about that, it's basically the level of estrogen that is going down and down. So if you're thinking about hormonal transition or about estrogen and it's going down, it's not just about reproductive system or fertility. It is the entire well-being of the woman. Okay?
Kesejahteraan.
Yes, kesejahteraan wanita. So it's very important hormone. So jadi perimenopause ni selalunya maknanya is sebelum head kita stop entirely. So menopause definition is when your menses stop for exactly 12 months. So bila 12 months tak ada menses, that's your menopause. Postmenopausal is after that.
Masuk second year tu dah.
So postmenopause is after that. Menopause is that day when you have normal menses for 12 months, you are menopause already. Okay? If you are normal menses for 11 months or 10 months only or 1 month, 2 months, you're not menopause yet. Okay? Officially, you're not menopause yet, even though you feel like it. That's perimenopause. Okay? And perimenopause ni, usually we say the symptoms of perimenopause can happen between 5 to 10 years before you menopause. Okay? Yeah, so you can happen it in the early 40s, but usually mid 40s, late 40s, you can start feeling it. And when we talk about symptoms, okay, we can categorize it first as systemic symptoms. So systemic symptoms ni paling common sekali adalah your menstrual cycle lah. So because kita ni estrogen naik turun kan, dia tak macam dulu. Dulu kita dapat menses every month kan. So kadang-kadang menses datang terlampau frequent. Okay, kadang-kadang menses tak datang. You miss 1 month, you miss 2 months. Sekali menses is all over the place.
The amount of bleeding tu lain.
Yes, amount of bleeding. Some people kata, kenapa bleeding I sikit je. Some people, oh my god, my bleeding is very, very heavy. Sometimes support. So there's all these changes is your menstrual cycle because the estrogen level is going up and down and it's not as stable as it was before when we were younger lah, basically. Okay, that's one. Second, we call the systemic symptoms is vasomotor symptoms. So this is the one women keep complaining. It's hot flashes. Tiba-tiba mana-mana panas. Aircon dah macam dah 16, 20 ke minus 20. Kenapa itu nak panas? Okay? And the other thing is night sweats. Okay, and then you wake up, you just drench with sweats. Now actually, for Asian women, hot flashes and night sweats are not really that common. Okay, what is more common in women, Asian women, muscle and bone ache. You just suddenly, you sleep well, you think you eat well, but you're still really tired. Ache here, ache there, and then, and also with sometimes you can't sleep well as well. Insomnia is one of the most common reason, especially for Asian women. You can't sleep. You wake up 3 o'clock in the morning, can't really sleep again. Cannot sleep. So that's one, okay? And the other one, remember, estrogen receptors in our brain. So psychological symptoms are also common. Brain fog. Okay?
Which I heard of now.
Yeah, so brain fog, so mood swings is very, very common. So mood swings are very common. Yeah, and then brain fog is common. And you know what brain fog is like? I mean, you want to do something, you go to a room, you forget. Then you come back. So it's like brain fog.
You know that I now have, oh my god, I ada planner. Dalam my phone, my note, I buat plan hari ni. Dekat office ada satu buku, I tulis. Dekat atas meja dalam bilik, ada satu buku. So I've got 3 planners so that I don't forget.
Yeah. So you get that, and that's real. Brain fog is real. Okay, mood irritability is also real. Okay, so these are a lot of women that come to me and they go, I'm not myself anymore. I don't understand why I'm not myself anymore. And and this is most of the time the signs of menopause or perimenopausal symptoms. So that's the systemic symptoms. There are local symptoms, okay, because remember, estrogen receptors also are in our skin. it makes us have supple skin, nice skin, collagen,
Glowy.
glowy skin, because they help us make collagen. So when the estrogen is lesser, our skin becomes dry, not only in the whole body, but down below as well. So you start having very dry kind of like vaginas, and then you get dry vagina, you get a lot of symptoms of urine infection, you get a lot of symptoms of infection down below. Having sexual intercourse also is going to be painful, okay, because there's no lubrication. But the one concerning issue when it comes to menopause, if you don't look after yourself, are the long-term consequences. Okay? So the long-term consequences are, the main thing is osteoporosis. Because estrogen protects our bone, makes our bone stronger. When we have less estrogen,
Osteoporosis tu kalau ada makcik-makcik tengah dengar kan, osteoporosis tu biasa dengar, tapi dalam bahasa layman macam mana?
so kiranya osteoporosis ni, we have brittle bones. Maknanya kita punya bone dah
banyak longkong-longkong.
so
Tak padat
kira, tak padat macam dia dah tak kuat dah. Okay, jadi tulang kita ni kalau kita tak kuat, jadi kita boleh more risky of fracture, especially hip fracture. Jangkau dia boleh patah. Okay, so bila kita ingat kita hidup sampai another 30 tahun or things like that when we menopause. When we have brittle bones, bila kita ada fracture, that will reduce our quality of life. Okay, then because nanti we are in a wheelchair or kita tak boleh jalan and things like that. So fractures is one of the things we want to avoid. But osteoporosis, kalau kita tak jaga, we are all at increased risk of that. The other thing that is increased risk of is cardiovascular disease. So bila kita belum menopause, memang the risiko untuk mendapat macam sakit jantung or cardiovascular issue is much lower for women compared to men. Okay, we get protected. Our estrogen protect us from cardiovascular disease. Bila kita sudah menopause, there is not enough estrogen anymore. Jadi kita punya the gap of the risk of cardiovascular disease between men and women becomes closer. So our risk of cardiovascular issues becomes higher. If after 5-7 years after menopause, kita dah macam our risiko dah macam the men dah.
It's very important that bagi yang mendengar ni, sebenarnya perimenopausal tu, iaitu simptom yang boleh berlaku 5 hingga 10 tahun sebelum the actual menopause, it's real. It's not just in your head. It's not overthinking. It's real. It's how kita sebagai wanita dikerahkan sebegitu. Jadi kalau ada simptom seperti systemic, like you mentioned, hot flashes, susah tidur, sakit-sakit badan, ataupun gatal atau kering di bawah, kan? Pada tidak, kita busy kan kerja, takkanlah macam sikit-sikit pun nak jumpa doktor kan. Tapi this is when we need to be aware. So when should we seek help? Bila kita kena berjumpa dengan pakar gynae atau pakar sikit puan, bila tanda perimenopausal dah bermula. Bukan tunggu menopausal.
Betul.
Apa yang macam red flags? Okay, kita kena jumpa you.
And also kalau estrogen tu dah berkurang, is it possible to get, I don't know, vitamins or shots?
Something we can do to
boost our estrogen. Kalau banyak sangat jadi macam mana pula?
Okay. So the first thing is to recognize the symptoms, right? So kalau dulu selalu wanita, bila kita rasa macam kita ni macam tak, dan we are not ourselves. And orang suka you're just getting old. Okay? We have to stop thinking about that. We have to you don't emo. So we just keep it ourselves. So we have to stop about that. Okay. Before I forget, Happy Mother's Day. So that's the one thing. Once you have, bila kita tak fikir je yang we are not ourselves, there's something wrong, that's when to see a doctor. See your pakar, at least just to have a chat, to talk and to see that, this may be perimenopause or menopause or even these other things, just to get checked. Okay. But now, memang it will be great if there's a magic pill to counteract all this, okay? But in reality, there's none. So what I always tell women is that, yes, when you have a low-level estrogen, yes, we as doctors, we can help you. There are hormonal options or non-hormonal options or tablets or gels that we can help to give back the estrogen just enough level to function, to actually eradicate all these menopausal or perimenopausal symptoms, so you can function as a woman. Okay? Function optimally. Up until as long as you want. But I always tell the women there is only so much that I can do. Okay? There's so much medicine I can give you. The most important thing is your foundation. Your foundation has to be strong. Okay? When I talked about foundation, maknanya ada 4. Healthy eating. We need to make sure that we eat healthy. Okay? Because the most important thing is that remember when I said your insulin don't really work very well when we are menopausal, right? Okay? So that means that our sugar, we keep more sugar. So if we continue to eat not healthy, we keep more sugar, the sugar then becomes fat, then the fat, where does it go? It doesn't go all over the body.
Kita pakai tertentu.
It goes to the stomach. And
Happening already.
and that's what we say that women have menopausal belly. But also it's so the rate of obesity is also higher. Okay, so that's the one thing. Healthy eating is very important. Second, exercise, active lifestyle. Okay, active lifestyle is not just I walk my cat. Basically, it's not that. Healthy lifestyle, you really need to at least exercise, and I always advocate for strength training. Now, strength training is very, very important for women, especially in the 40s and above, but actually for everybody. And there's no age limit.
Strength maksudnya nak build muscle tak?
No, it's not. Strength training is weight training, but it's a functional weight training. It's not like you don't want to be like Arnold Schwarzenegger. It's not that.
Okay.
Okay, it's basically strength training is a very it's a training for women to make their bones stronger and their muscles stronger. Okay? You're not building muscle, you're making your muscle stronger. Because kalau kita punya otot-otot kuat, dia akan pegang tulang kita dengan lebih kuat. Bila dia pegang tulang kita dengan lebih kuat, tulang berkata, alamak, this woman is, building something. I have to be stronger. So the bone then becomes stronger as well. Okay, and that's what reduces our chance of osteoporosis in future. That's number 2. Second, sleep. 7 hours every night. Okay, you need to have at least 7 hours of sleep. About 7 hours of sleep every night. And fourth, stress management. You need to make sure that you know how to manage your stress well, because people talk about cortisol. Okay, when you're stressed, you get higher cortisol level. When you have higher cortisol level, and that's why all this is all a vicious circle. So when I say to women, when they come to me and they go, I have all these symptoms, I want to be myself again, and and I will always ask them, do you exercise? Do you eat well? How's your sleep? How do you manage your stress? Because kalau you don't manage all this, because we know that women that have a very strong foundation, 75% of the time, the menopausal symptoms will be gone or will be much lesser. And you transition to the menopause in a much smoother way.
Sebab in the menopause ni bukan sesuatu yang to be ditakutkan.
Yes. Memang itu, it is a natural occurrence. Okay? It's the next phase of our life. And remember, we are lucky that we are actually experiencing menopause. Not all women can live that long. Not all women can live that long.
I see what you
To
mean.
experience the next transition of life. And remember, it's not just about the symptoms. We are older, we are more experienced, we are more mature, we have wisdom. Okay, so those are the things that we can also that.
And also having a support system in the sense of our husbands.
Yes,
Family.
So whoever male figures we have around us in our life to understand what we're going through. Yeah.
So having a supportive surrounding is very important. So we have.
But men don't get, there's no like equivalent of menopause for men.
Well, there are some people argue there's an anthropause, but I'm not an expert to that. So we do, so that's something I can't really.
Sebab kalau dua-dua lelaki dia ni ada macam menopause symptom, susah
Sebab
juga
dia
tu.
pun andropause. Why dia menopause? Aduh. So macam mana? Kena understand each other lah. That's why we have podcast.
Yes.
As pendengar,
Betul.
as pendengar sekali. So before we move on to the next question, just Dr Ida, you mentioned about weightlifting, bina masa as the one of the key elements of your 4 pillars of foundation. Because in my clinic, I also say the same things to my patients about healthy eating and exercise as something that we can control within our hands, is in our power. But sometimes you need a bit of internal motivation other than doktor je bagi tahu and it's healthy, so you buat, tapi sebenarnya you tak the real clarity kenapa you kena buat. So I'm just sharing in this era zaman berubah and family are getting smaller, and I pun tak ramai, I have 2 children, And I have my brothers and sisters, tapi everybody pun also busy kan. So bila kita dah tua nanti, do we have a community around us? Macam kita ada tak? Macam zaman dulu ada kampung, you ada jiran-jiran kan. Now we are living in the cities, in condos. So I just want to be able to, dah tua nanti boleh naik tangga,
Yes.
murut turun tangga,
Exactly.
and boleh maybe tolong jaga cucu. So I when I go to gym, I focus here and here.
Yeah.
Because I nak naik tangga.
Yeah.
I just saw a video of Ida's mother. How's your mom?
She's 80 this year.
And she's at the gym, okay? At the gym carrying weights.
Yeah,
Like,
she's doing
amazing.
strength training now.
Yeah.
She's very early. Oh, she just started. Okay, so and the reason is because like what you said lah, because even though however old you are, your kids are all big, but you're still down on your kids, right? I mean, you forget about your own health and things. So last time that the last time I saw about a month ago, when you started, she looks a bit fresh. She's very independent.
Yeah.
She walks around everywhere. She
Yeah.
very
sharp.
very sharp, is it? And then started to dwindle. And I know that's just because yes, all of us are busy. So she's alone at home. Then and there's not a lot of exercise because she had knee pain. Okay, stops her from exercising. So then I realized that actually we need to start doing something. So she went for strength training. And 2 weeks after strength training, knee pain gone.
Oh,
Okay,
wow.
she still have got a long way to go, and we realized that she has no muscle. There's muscle wasting. That's the one thing that we have when we are older. Kalau kita tak exercise, we have muscle wasting. Bila kita ada muscle wasting, then the muscle will pull everything together. Sakit sini lah, sakit sini lah. So after about 2 weeks of strength training, she can start going down the stairs herself, going up the stairs herself. She's much more mobile. So we're just continuing that. And she's early.
Kat rumah ke you pergi?
No, we are pergi gym lah. So the one thing that I always tell our women is that kalau you nak buat strength training, okay, first thing is please try and get somebody professional to do it with you or to because jangan buat sendiri because you can injure yourself. Yeah, that's the one thing. Jangan buat sendiri. You can injure yourself at least for the first few sessions. Okay, make sure you have either a personal trainer or somebody monitoring you to do the right exercise because there's no point of doing the wrong exercise by yourself. You don't really know whether you're having a benefit or not. So make sure that you have somebody to help you doing the right exercise, the right repetitions, the right weight. Because kalau tidak nanti you just going to injure yourself. It doesn't just an issue. Yeah.
Can I just ask, like, your experience with your patients? Like you said, there's the pre-menopause, the menopause, and then the post-menopause. Is it called post-menopause?
Yes.
Okay. So you've seen, obviously, our patients go through all different. The ones that have, like, post-menopause, do they have, like, a sense of relief, maybe, having now gone through menopause? Because kadang-kadang you're waiting for your period, it doesn't come, and then it comes twice a month or whatever. So kadang-kadang it can disrupt your life juga kan. Do they have like a sense of relief that, okay, I can put that behind me now?
It depends, okay? Because obviously, if you're just talking about your menses, yes, it's some women they are absolutely relieved.
So the hot flashes stop after
Well,
I-
not necessarily because the menopausal symptoms you can have it earlier at perimenopause level, during your early postmenopausal level. How long the menopausal symptoms last? It's totally different for different women. Some women it only lasts for 6 months or less than a year. Some women it's for 1 or 2 years. Some women very long time, even more than 5 years, basically. So it's very difficult to predict when your menopausal symptoms will stop, the systemic symptoms lah. But for especially for menses, now the women, the response is very different. Some women they go, yes, I don't have to go and buy pads. I don't have to worry about menses. I can wear white without even thinking about anything, right? Some women they feel it as a sense of loss. Okay, and because they feel, and that's what we need to change.
sense of purpose.
Yeah. We need to change that. It's not something because they feel
ashamed.
it's not something to be ashamed of. And you go, oh, I don't have menses anymore. I'm so old now. I mean, age is just a number, basically. So it doesn't matter. What matters is what you do with your life at that age that you are now, and also to invest now what you want to be in 20, 30 years' time, basically. So that's the most important thing.
Life doesn't stop just because you're menopausal.
Exactly. Actually, life probably just started and it's probably just going to be more fun.
Yeah, I want to move away now from menopause because you also deal with fertility, specialize in fertility as well. And I'm sure you have women come to you with other issues that are related to relationships. I mean, also going to say was with the vagina, problem with the vagina, uterus, but one of the things is, relationship. So, there's a lot of things out there, issues out there yang tidak sihat di masyarakat kita, negative things. Kadang-kadang mengerikan juga kan, some of the stuff that we read on news. So we try to jalani kehidupan yang sihat dengan, like you said, taking care of what we eat, exercising, having checkups. We haven't spoken about that yet, but we'll get to that later. But kadang-kadang penyakit berbahaya boleh datang. Sometimes it's not from us. Sometimes it may be from our partner. So, pasangan kita sendiri yang sepatutnya kita boleh percaya dan yakin dalam hubungan kita, but it happens. So, this is what we read sometimes in the news kan. So, this can be membimbangkan sebab kepercayaan yang kita beri kepada pasangan kita in a way will affect us also. So, basically I'm talking about if they pass something on to us. So, dalam perhubungan kelamin, and it can obviously usually bring a long term effect on us, not only us, our kids as well. So have you ever dealt with a patient that had to come to you with a situation like that? How do you deal? Because that can be it can also almost be like a patient coming to you who you find out has cancer. It can be like
Devastating.
yeah, and
Okay.
yeah.
So what I'm going to do, I'm going to just try to answer this in let's just unpack this in a much more kind of gentle
I
manner.
ask this because also when you read this, because I've read articles saying that women get so depressed because, like I said, it's trust issue also, and then shame because that obviously there's something not right with their marriage or relationship or whatever, and they're shy to come forward, and then sometimes they just go on living their life without even sorting out the problem medically or just even their emotions. So
Okay. Yeah.
yeah.
So it's true. Okay. So I see quite a lot of well, not a lot, but then it's quite a common issue that I see lah in some of the women in my clinic. Okay. Tapi to tell you the truth lah, okay, when we talk about, for example, sexual transmitted disease, okay, or we call it STDs, okay, and yes, you are right that when women come to me, they have the diagnosis of STD is either chlamydia, gonorrhea. These are the most common STDs, and either trichomonas or even HIV or hepatitis B. Okay, so these are the commoner STDs, and they say that, doctor, I've eat right, I've exercises. I mean, look, I've been faithful, I've been doing all the right things. Why does it still happen to me? Why me? I mean, this is not fair, okay?
Yeah.
And they feel betrayed. And in some cases, that is right, okay? And it is right for women to feel that way. But we need to remember, when it comes to sexual transmitted disease, it's not just men giving it to women.
True. Okay.
But women also
True.
can give it to men. Okay? And the reason is because these chlamydia, gonorrhea, and all this, most of the time they are asymptomatic. They don't have symptoms. They just lay there dormant. We don't even know, but they genuinely do not know that they have it. They may have it from previous relationship. We don't know. But and they transfer it to the newer relationship. Okay? So and men and women, they generally do not know that they have it when they pass it to their partner. Okay. The most important thing about having the diagnosis for me lah, okay, as a doctor, is first to understand the diagnosis, okay? Understand it, and to educate the couple for both of them regarding the diagnosis. When I do have conversation about sexually transmitted disease, or when the diagnosis is made for a couple, I try to steer away from talking about who giving it to whom. Okay? Because the reason is that it's almost always the answer is not useful.
True.
But it's almost always it causes unnecessary pain. Okay? So that's one. The first thing we need to understand is that yes, the diagnosis is made. What are we going to do now? Okay? We need to treat it. Okay? Because there are good treatment, antibiotics, that can actually eradicate the infection. Okay? We need to make sure that, the infection does not spread or recur in future. So we need to treat not just the woman, but the partner as well. Treatment is shared. Okay? The diagnosis is shared, the treatment is shared. We need to also educate both women and the partner in terms of how to prevent it in future. We need to have an open conversation with them about the importance of how to reduce the transmission in future. Things like barrier contraception, like for example condoms. That is the one contraception that actually single one contraception that can actually reduce the transmission of STD in future. Now, for the couple, yes, in terms of they have to have a conversation, and the conversation about STD for me, it needs to happen way before marriage, especially when you
I was
start
gonna ask
having
you,
a serious relationship.
So when do we talk to our kids about all this?
The
Sons
kids
and
will know
daughters.
about it. The kids will basically, because now social media is everywhere. You cannot help that, the kids will have some kind of inclination about it. But for me, the couple itself, it's not us. But we can mention it. But to me, the most important thing is when you are already in a serious relationship, even way before your marriage, you need to start having this conversation. Okay? You need to basically talk about, normalize that going for screening is important. It's not because of distrust. It's because you love each other. You do not want to pass. It's your responsibility. You need to have this kind of open conversation with your partner that yes, because I love you, let's go for screening. Make sure that both of us are healthy. So so that is not a taboo.
In Malaysia pun sebelum kahwin nikah is actually HIV ni kan. So that is a way of national level.
Yes, it's a national level. But between the couple, so before you get married, you have to have this conversation. The education has to be there early on that these are the ways that we can reduce STDs. And the question that you say that who doing it, whom, what to do, what do I is it you, is it me, to me, I treat the condition, I educate the couple, I try not to be judgmental. That conversation is a private conversation between you and your partner. Okay?
So if somebody is watching this and they're going through that situation, they should talk to their partner first about it and then go and see a doctor. But that if that's not the case, if it's a case where that partner is not willing to talk about it, they just want to brush it aside, then
it is something that they have to deal between them, because it's your partner. It's your partner for life. You trust your partner, you love your partner. So all this comes into play. But then, and you have to have that open conversation, because as I said, as a doctor, I can treat it, I can prevent it from happening again. I can educate everything. But and sometimes, yes, people go for counseling regarding this as well, which is something that some people do. But the first part is always knowing that you have to be ready to have an open conversation without blame with each other.
This might be a silly question, but STDs they're not fatal, right? There's no, or can they lead to fatality?
Majority of the time for STDs, for example, depending on the
Well,
STDs,
HIV, AIDS.
Yeah.
But even now, there's medication for
Yes,
it.
I mean, STDs, they are now, I mean, things like chlamydia, gonorrhea, they are now, there are treatment that can eradicate the infection and makes you like free of the infection. I mean, and most STDs are not really, it's not about fatalism, it's about the morbidity that they cause if you don't go for, if you have it or you think you have it, you don't get checked, you don't get treatment. Because, for example, chlamydia, they can cause infertility, they can cause a lot of infection inside your pelvis, they can cause in future chronic pain, all that. So that's the reason why we always want to treat. If you have symptoms, I mean, we want to treat the STD as soon as possible. We don't just treat you. We also want to treat your partner so that you don't keep on getting, you don't ping pong it to each other, for example. So it's the consequences of the STD that we want to prevent.
When this question leads nicely to my next question, which is slightly different, but it's mungkin ada kaitan dengan hubungan kelamin dan juga hubungan suami isteri. Because going back to the first question that Dr. Ida mentioned, after the years of 40 leading to our life expectancy 80 hingga 90 tahun, 3 benda tadi kan, menopause, chronic diseases and also cancer. Now, wanita selalunya macam breast cancer, kanser payudara is of course top 5, top 10 dalam National Cancer Registry di Malaysia. Inside that list is also another cancer pembunuh senyap, iaitu kanser pangkal rahim ataupun cervical cancer. Cuma mungkin bila cakap pasal, because I also treat cancers kan, the breast cancer part is very feared. Orang takut. And very good screening program with mammogram and self examination at home. But the other one ni, kanser pangkal rahim, tak ramai orang cakap. Tetapi sebenarnya dalam Kementerian Kesihatan Malaysia ada program untuk mencegah. So kita rasa minta Dr. Ida explain mengenai kanser pembunuh senyap yang kedua ni, yang ramai orang tak cakap tapi sebenarnya is there for us to know about.
So thank you for raising this question. This is my passion, okay? Cervical cancer prevention has been my long life passion. So you are right. I mean, you know, the thing that I always tell people, cervical cancer is actually preventable. No women no women should get cervical cancer. Kerana kita tahu punca cervical cancer. Now, when we talk about screening kan, okay, so memanglah macam breast cancer is number 1 in most countries for women. But the problem is that with breast cancer, it has to change to cancer first. Then the screening will detect the cancer,
The early
stages, stage 1 or stage 2. But kalau stage 1, stage 2, the prognosis is better. We can treat it better, okay? But cervical cancer, the good thing about cervical cancer is kita know the cause. We know the cause of cervical cancer. Because we know the cause, it's a very common virus. It's called human papilloma virus. Or for short, HPV. HPV is a very common virus. All of us, at some point in our life, will get exposed to this HPV. Okay? But the thing is that because we know the cause, we can screen for it.
screen virus tu.
Screen the virus.
Bukan nak
The
screen
cancer. We can screen the virus.
Check virus
Yes.
dulu.
We can screen the virus because the virus is a screening virus. We screen you for the virus because this virus can tell us what is your risk of cervical cancer in future. Do I need to screen you a little bit? Do I need to monitor you a little bit closer? Or do I need to just leave you and go routine screening once every 5 years, for example? Okay? Jadi the reason is because not only that we can screen it, we can also detect the cell changes before they become cancer. Kita dah boleh tahu dah macam mana rupanya kita boleh treat. And the treatment is very, very simple
But is this
compared to
screening
cancer
similar
treatment.
to having a pap smear?
No. Okay, so it's similar. So they are both screening. Okay, so traditionally kita guna pap smear. So kalau pap smear ni, a lot of the time, we it's an internal examination kan. Okay, so we take some cells from our pangkal rahim lah, which sits at the top of the vagina. And then somebody look under the microscope, dia kata, oh, ada sel yang abnormal ke yang boleh jadi cancer in future, ataupun ada cancer cells atau tidak. Kalau normal, okay, you come back in about 1 year, 2 years or 3 years kan. Tapi the problem with the pap smear, the sensitivity of a pap smear is very low. It's only 50%. So kalau anda wanita yang baru buat pap smear kata, oh normal. it's a 50% chance that pap smear missed a pre-cancer.
Cancer awal.
Cancer, not pra-cancer. Sebelum dia jadi cancer, because that's what we want to catch. HPV test is much more sensitive. The sensitivity is up in the 90s, 97%.
Mesti boleh buat semasa
Yes.
sama setting. You datang buat pap smear, you buat HPV test kan? Boleh?
Boleh, tapi it doesn't help with your protection. So current recommendation, you either buat pap smear or you buat HPV test. You tak payah buat dua-dua actually. Okay. Because current national guideline, I think in Malaysia juga and also in Singapore, that women boleh buat HPV test. Selalunya women 30 years and above. Just one HPV test. Tak payah buat pap smear. One HPV test once every 5 years. Sebab kalau HPV test kita buat, kalau dia negatif, risiko untuk anda mendapat kanser pangkal rahim dalam masa 5 tahun is actually less than 1%.
HPV test is still from pangkal rahim juga. It's a blood test or something.
No, it's not. It's just it's done like
About Israel exam.
yeah. But the good thing about the HPV test now is that memanglah macam masa awal-awal kita kenal ke HPV test ni, dia macam kita buat macam pap smear, kena ada internal, kena pergi jumpa doktor, kena ada internal examination, and then doktor buat kan. And a lot of women don't really like going because it's embarrassing, it's uncomfortable, itself. I mean, nobody wants to go to see a doctor and then have that speculum examination, and then it is very embarrassing. It's very uncomfortable.
Yeah.
So that's one of the barriers of doing a pap smear HPV test. But sekarang ni, as you know, because HPV test macam COVID lah. COVID kan kita ada the swab. Mula-mula orang buat untuk kita kan. Lama-lama kita boleh buat sendiri COVID swab, check sendiri. So now the HPV test, there is a self-sampling method. Maknanya it's just using the swab like a COVID swab, kita boleh buat sendiri. And
Boleh buat kat rumah?
boleh buat kat rumah. And then, and I think in Malaysia, the HPV self-sampling, that's what it's called. It is also something that initially was introduced in Malaysia quite early. It's and here I want to mention the program. It's called Program Rose. So Program Rose sekarang ni they are collaborating with the Ministry of Health, and it's it's established by my good friend and colleague Professor Wu Nining from University Malaya. So program Rose ni dia increasing the awareness of screening, the importance of screening for women, and using self-sampling. Maknanya buat sendiri on that day itself. And then they bagi dekat the staff, and then they will follow you up because they also have the digital follow up on your mobile phone. So they can actually WhatsApp you or text you your result and advise you whether nak datang buat lagi. So these are all ways of us trying to increase access to cervical screening for women, because we know that it's a virus. So as COVID, we also have a vaccine for it.
Siapakah wanita-wanita yang berisiko mendapat?
All of us actually.
Wanita yang dah berkahwin atau yang sexually active ataupun
Any of us, once we are already sexually active, we are all at high risk. We are all at the risk of exposure to the virus. Okay, it is not an STD. Okay, HPV is not a sexually transmitted disease. It's actually transmitted by skin to skin contact, and the most common way is by sexual activity lah. So that's why kalau kita sudah we are already sexually active, the government will say you need to go for your cervical cancer screening. The only people that are not really exposed to the risk of cervical cancer are the ones that has never had sex. So they won't tak payah pergi screening, because the risk of cervical cancer is much lower.
Kalau tidak tak nak mention tadi kan bahasa yang untuk HPV ni ada vaksin.
Yes, macam COVID lah. So because of the virus, kita tahu, so we have the vaccine, and the vaccine is very effective, especially if you give it when you're young. Okay, sebab the HPV vaccine ni, there's no vaccine in it. There's no virus in it, so it cannot make you HPV positive. But what it does, it tricks the body into thinking you are exposed to the cancer-causing HPV. So so then the body makes a lot of like antibodies lah, and then to protect us. So kalau macam in future, when we are exposed to the virus, your body is already protected. So the vaccine is very effective, and I think Malaysia is one of the earlier country in around the Southeast Asia that introduced the school HPV vaccination program in 2010. So Malaysia was the first one that introduced in 2010. So now it's about 16 years now. So the girls that have been vaccinated in 2010. Now they are growing up protected adults from cervical cancer. They still have to go for screening, but their risk of cervical cancer obviously will be much lower than us lah that do not get the vaccine.
Untuk budak form 4 kan?
Yeah, different countries will give it at different time. Tapi kita tahu kalau macam yang paling efektif sekali kalau kita nak bagi vaksin ni sebelum dia the exposure happen. Tapi kalau between 9 to 14 years old is the best time to give. Okay, so sebab tu bagi dalam sekolah menengah lah. Sebab masa kita bagi dekat sekolah sebab that is where we can actually get most of the vaccination.
So it's not a national school program yet.
It is. I think it's
This already.
It's a school vaccination.
So
It's a
the
school
girls
vaccination
are
program.
getting it in
Yeah.
school. Okay.
Since 2010.
Oh wow.
Yeah,
Okay. So I wouldn't know because I have a son.
Boys can get boys can get vaccinated as well. Needs to get vaccinated as well. So the HPV vaccine is not only for women.
Okay.
It's also for boys, but certainly for a lot of countries, the school HPV vaccination program is focused on girls because the most burden is cervical cancer. Tapi the vaccine is also licensed to be given to some of the vaccines to be given to boys as well because the same virus that causes cervical cancer in girls can also cause anal cancer in boys and as well. And in America, it's recognized to cause some throat cancer. So giving the vaccine to boys not only protect them from HPV-related cancers, but it also protects them from another HPV condition that is not cancer-related called genital warts. Okay? And also, boys who are vaccinated, they also protect their future partner from cervical cancer because they don't get the virus. So they don't get the virus, they don't then transmit it to their partner and vice versa. So if both boys and girls are vaccinated, then inshallah, in the long run, we can eliminate cervical
For the
cancer.
future.
For the future.
Fariza, kita dah banyak bincang ni macam-macam topik tapi sebenarnya we haven't even touched on fertility, which is also another thing that Dr. Ida specialises in. Tapi maknanya mungkin another episode kita invite Dr. Ida lagi to speak about fertility.
I'm not really a fertility specialist, but preconception and all that we can talk about that.
Okay. So I just want to sum up a little bit. Jadi kesihatan wanita merangkumi penjagaan fizikal, mental dan emosi, khususnya kitaran haid, kehamilan, penyakit seperti kanser payudara dan serviks. Pemeriksaan berkala, regular check-up seperti pap smear, mammogram, HPV, which is a big thing that we discussed today. Serta gaya hidup sihat adalah kunci utama untuk mencegah masalah seperti PCOS. What's PCOS?
Polycystic ovarian syndrome.
Okay. Fibroid dan
Endometriosis.
Secara keseluruhannya wanita memerlukan maklumat, which we hope with this podcast we've been able to give. Well, Dr. Ida has been giving a lot of information, useful information for us. Dan sokongan yang tepat, like we said, getting support from our family, even kids. If having our kids to understand what we are going through right now, like mom's not having a good day today, the hormones are a bit, so yeah, to have good sokongan. So untuk melindungi kesihatan diri kita daripada jangkitan, ketidakseimbangan hormon dan pertumbuhan yang tidak normal, jadi marilah kita didik kita hari ini. Starting with this podcast, hopefully you get the information. If you need to have a talk with your partner, have that talk. If you're thinking about going to the doctor, go and see the doctor. Just
Have a chat.
have a chat with your friend. Just voice your concerns, but don't just let it
Keep inside.
keep inside. Don't just let it fester. I think that's the most, because then you start to overthink, and then you cause yourself stress, and then you bring on the menopause even faster. Jadi sama ada kita menikmati hari spa, treat ourselves to just go to the spa, menjalani pemeriksaan kesihatan, very important. Mencari therapy is Fariza my therapy lah. Fariza, you know what happened to me today? Macam, oh Ida. But Ida's in Singapore, so
It's me.
susah nak jumpa, so call. Kalau dah jumpa terus Fariza. Or just go for a walk. Just go for a walk.
Enjoy nature.
Enjoy nature. Just clear your mind. You don't. Sometimes you just need to be with yourself. To just say, I'm okay. This is okay what I'm going through. And I think berhenti seketika. Just stop for a while and take a deep breath and say, I got this. Okay? The world's not going to stop.
I'm worth it.
Yes.
I am worth it.
I am worth it. Yes, betul. And lastly, I take a deep sigh because I think this is something that I do. I need to berhubung semula dengan diri anda sendiri. Connect with yourself again. Because sometimes we're so busy with our lifestyle and everything, and we just forget who we are. We forget our essence of ourselves. So, because at the end of the day, like you said just now, it is about mental health also. I mean, all of our topics, they always end up about mental health.
It's connected with physical
Yeah.
and mental.
Yeah.
You're busy taking care of everybody else, you don't take care of yourself.
Yeah.
And hence, we need to remind
Yeah.
ourselves first.
Yeah.
And hopefully other people can be reminded as well.
Betul. So thank you so much, Dr. Ida, for
Thank you for
coming all the way here.
Any last words for us, pesanan-pesanan?
So jadi, I think the last word is that, as you said, that we as women, we are nurturers, natural nurturers. We want to look after everybody.
Betul.
But while we are looking after everybody, and since today is Mother's Day, I need to remind everybody, you also need to look after the women in your life. Okay, so it's not just about bringing them flowers. It's not just about, going for dinner. It's also reminding them to have me time.
Yes.
Okay, you can have your me time. Make sure they go for their screening. Make sure that they are also asked about how they are, what are they are doing. Because when we are healthy physically and mentally, and naturally we continue to look after everybody else in our life.
Yes. Yeah.
Yes, so I wish we can go on further. Sambung je lagi cakap kan. Tapi
Banyak lagi
tak boleh. Director dah bagi signal. Suruh wrap things up. Jadi terima kasih kepada Dr. Ida. Such a pleasure to have you. And my take-home message from this is also going back to what Dr. Ida says. The 4 things kita wanita kena buat 4 benda ni untuk diri kita. 1, jaga makan, kurangkan gula, pergi gym, bina otot. So nak dah tua nanti nak naik tangga, turun tangga kan, atau nak dukung cucu kan. Sleep minimum 7 hours, and also manage our stress. And it's not up to other people to manage our stress, is actually up to us. So take regular breaks, connect with nature, and please go to medical checkup. Dah umur 40-50, please go for mammogram. Make sure you're up to date with your pap smear, buat HPV test, and apa lagi? Breast self-examination, and also go for cardiovascular checkup for your cholesterol, kencing manis juga, and also check for your bone density. Sebab kita insyaAllah dari hidup sampai umur 90 tahun, insyaAllah.
InsyaAllah.
Okay, thank you so much, and please stay tuned and join us in our next episode.
Jangan lupa ikut kami. Follow us and subscribe. Itu yang penting, subscribe to us on YouTube and Spotify. Dan sampai kita jumpa di episod lain. Take care of yourself and let's be kind to each other.